All right. Morning, everybody. Thank you for joining us today. Just going to let everybody kind of trickle in here a little bit before we get started. All right. Well, thank you for joining us today. For those of you who don't know me, my name is Travis Dune. I'm manager of business operations for DRCOG's Area Agency on Aging. And we are going to discuss today our open funding opportunity for Older Americans Act funding that is currently open. So we're going to go through an overview of that funding opportunity. We're going to talk a little bit about the elements that are required in the proposals. We're going to go through the evaluation criteria for proposals, contract requirements, and then there should be plenty of time for questions and answers at the end of this session. However, you're more than welcome to put questions in the chat as I go along here, and I'll do my best to answer them as well. So getting into the review, just a little bit about DRCOG. We are a planning organization that works with local governments to collaborate and establish guidelines, set policy, and allocate funding in various areas, including aging and disability resources. DRCOG is the designated area agency on aging for the 8-county Denver metro region. And because we are the area agency on aging, we do uh, our area agency on aging, this 8-county region includes Adams County, Arapahoe County, the city and county of Broomfield, the city and county of Denver, Clear Creek County, Douglas County, Jefferson County, and Gilpin County. That includes the entirety of all of those counties. There's a map here on the right that has all of that highlighted as well. But because we are the area agency on aging, we do get federal Older Americans Act funding as well as state funding for senior services funds. These fund a variety of community-based services intended to help older adults maintain their independence and remain in their homes and communities. All the services that are funded through DRCOG grants here are available at no cost to individuals aged 60 and older. And the services are also not means tested, meaning that the only requirement, generally speaking, is that individuals are 60 and older. So we are seeking proposals for community-based services just to serve older adults 60 and older and their caregivers in the 8-county Denver 8-county AAA region. Funding and grants from this notice of funding opportunity will be awarded beginning July 1, 2026 and ending June 30th, 2027. As well, DRCOG at their discretion may extend contracts for an additional 1-year period after this initial period of performance if we choose to do so. The funding that is available, we do anticipate approximately 13.4 million will be available for grants awarded through this funding opportunity. That is basically flat funding from what we've had in prior years. The available funding is an estimate currently and is subject to continued appropriations from the federal and state governments and may be reduced or canceled at any time. And we do have to follow the requirements outlined in the state's policy and procedure manual, as well as the federal requirements for allocating the funding to the various services. Beyond that, DRCOG does prioritize funding towards services that meet the most basic needs for older adults before providing funding for other supportive services. So just a little bit of a breakout of what that 13.4 million looks like. The federal funding that DRCOG gets is the Title III funding here, and it is broken out into 5 different parts for specific services. And then the state funding for senior services funds is one bucket of money. And I'm going to touch on what all of this looks like and what these services are here coming up. So for Title III Part B, eligible services include adult daycare, chore, counseling, education, homemaker, information and assistance, legal assistance, material aid, personal care, screening, and transportation. One thing to note here is that DRCOG is limiting material aid proposals to only material aid food, so groceries, food, etc., not other material aid that is eligible typically. We do have to allocate 43% of our Part B funding towards priority service categories. That is access services, in-home services, and legal assistance. Access services is transportation and information and assistance here. The remainder of Part B is prioritized for basic needs first, which would be the in-home services under this. The other federal funding parts we receive include Part C1, which provides funding for congregate meal programs throughout the region, Part C2, which provides funding for home delivered meal programs, and then Part D, which provides funding for evidence-based disease prevention and health promotion services as certified by the National Council on Aging. So if you're interested in proposing an evidence-based program, there is a list of those that are eligible for that funding on the NCOA's website to see if your program meets those requirements. Part E funding provides funding for caregiver support services, which includes respite, counseling, support groups, and training. Part E also provides funding for older relative caregiver services or grandparents taking care of grandchildren support services as well. The state funding for senior services funds do fund any of the services that are eligible under the federal funding parts. And as I mentioned, we do prioritize the funding for towards those services that meet the basic needs of older adults. Those priority services are nutrition services, so home delivered meal programs, congregate meal programs, material aid food, groceries, and then transportation and in-home services are the priorities. In-home services being homemaker, personal care, and chore services. One thing to note about information and assistance requests, if you are looking to request funding for information and assistance, DRCOG does require all applicants to provide some level of information and assistance to older adults, that is connecting them with other resources if they need help. In order to be considered to receive funding for information and assistance, you do have to make sure that service is unique and separate from the service we ask everybody else to provide. And there is narrative questions in the application that will ask you to justify that and provide information about what that looks like and how you track it and how it's different from these other information and assistance services that we ask everybody to do. As far as eligible applicants for the funding, it's any organization that provides the eligible services to older adults. You're eligible to apply. This includes nonprofits, government entities, for-profit businesses, partnerships, etc. We do give preference to disadvantaged business enterprises. So that's organizations that have a 50% majority of, or more, 51% of their board or ownership in by a minority group. That is a requirement in the state's policies, so we do give preference to those entities. Other information you should be aware of, DRCOG does request that minimum requests here are $75,000. If you request less than that, you can. You'll just be required to provide a justification as to what that looks like. There is no maximum request for this NOFO, and DRCOG is encouraging new providers or services to reach out to us and have a conversation, just to make sure your services are eligible before applying. So we're happy to take those calls and chat with you to make sure that you're eligible. The grants do require a minimum local match. For caregiver services, that is 25%. For everything else, it is 10%. And that is 25% or 10% of your total budget. So your match plus your grant funding. So if your total budget is $100,000, our grant would cover, if you're getting caregiver services, 75,000 of that, or if you're getting proposing other services, it would be 90,000, and the rest of it would have to be made up by either local funding or in-kind contributions. So either cash match or in-kind is eligible here. In-kind contributions must be documented clearly and identified in the proposal. We do encourage providers or applicants to use cash match to meet at least 10% of the minimum local share. It's not a requirement, but we do encourage it. And we do consider matching contributions as a factor in evaluating proposals. You are welcome to overmatch the grants, and that is again a consideration when evaluating the proposals. Eligible funding to be used as match on these grants. You just can't use other federal funding or other funding that's used to match other grants to match these ones. So our schedule here, this is open. The applications are open in web grants. They are due to DRCOG by 5 p.m. on January 16th. We will be reviewing proposals kind of January through April timeframe. And if we do schedule interviews, we will be scheduling those kind of late January in through April, depending on the schedule of review of all of the proposals and how long it takes us to get through all of that. We do anticipate final approvals to be completed in May, early May, and we'll send out notices of awards. And contracts will start to be issued kind of in that early May, late May timeframe as well. And again, all contracts from this opportunity will begin July 1st, 2026. I'm going to get a little bit into just the details of the proposal and what this looks like, the structure of it. So you know what we're requesting. So all of the proposals do need to be submitted on DRCOG's grant management system web grants. You can register for account on that system. There's a link on the main login page to request an account. You can just fill out the information and it'll come to us for approval. We'll get it approved as soon as possible. All of the funding opportunities that are available currently are listed in the system under the funding opportunities menu item. We do have 3 current open funding opportunities: the Older Americans Act and state funding for senior services opportunity, which we're talking about here. Then there's 2 transportation specific funding sources that are open as well, which includes Federal Transit Administration Section 5310 and the Human Services Transportation Set Aside. We have information sessions scheduled for those tomorrow if you're interested in your transportation provider and you're interested in those funding opportunities. So the outline of the proposal and the elements that are required, and there's general information, program description, budgets and budget narratives, unit and client counts, a service narrative, organization overview, and then risk assessment and attachments that will be required for all proposals. The general information and program description really includes just the title and context for the grant. One thing to keep in mind is that as you're building this application, there's going to be an opportunity for you to add contacts to the grant in web grants. The individuals, if they need access to the grant, if you have multiple people working on it, you do need to add everybody as a contact to the application in order for them to see it. If they're not listed as a contact and nobody else in the organization will be able to see that application. And so you'll just need to be cognizant of that and make sure you add everybody who needs access to that application as a contact to the grant. The program description is really a high-level executive summary of your application, and we're going to, just ask you to include the total requested and the services being requested in that program description. You will have to submit a service budget, detailed service budget for each service that you're requesting in the proposal. So if you're requesting multiple services, you'll have to build it out for each of those. And you'll have to identify the funds you're requesting as well as the matching funds. The system will calculate the minimum required match based on the grant funds you're asking for. So your identification of match needs to be at least equal or higher to that. And expense budgets are broken out based on various categories listed in our system. And we do just want you to make sure that the expense budget is equal to the revenue. So the budgets should balance there. If it's not, there's nothing in the system that would stop it from being submitted, but it does need to be balanced for completeness of the proposal. And then just one thing to note about in-kind contributions, it does need to be identified in both the revenue and the expense categories of the of the proposal. So if you're using volunteer time as an in-kind contribution for matching purposes, we would expect in the expense budget to have a line item that is for volunteer hours to account for that as an expense. A new section we added this year, if you've submitted applications to us in the past, is a budget narrative section. Some of this is information that is or was asked to be attached to applications in the past, so we just built it out in the system. The first section is the proposal personnel details. So we're going to ask you for a listing of the individual positions working on the grant, including their corresponding salaries or hourly rate, hours, and percentage of time charged to the grant, as well as the titles, description of the work they do, etc. The table, like this table in this section, should equal the personnel table on your expense budget. So the expense budget doesn't have really, you just have one personnel line that is your total personnel, and this is providing all of the details on what this looks like. So just make sure that those equal. We also have an indirect expense calculation table now. So if you're planning to use indirect or charge indirect expenses to the grant, either using the federally negotiated indirect cost rate or the de minimis rate, and it will ask you to step through this. If you're not applying indirect costs, you can skip over this table, but it will ask you for your rate, your base, the numbers there, and we'll calculate the indirect cost based on the information you provide. It'll also give you an opportunity, if you do have a federally negotiated indirect rate, to upload the approval letter. There's a question in the chat about the personnel table. Do we lump same positions together or separate out by person for the same position? It's fine to lump the same titles together. So if you have, I don't know, say like 5 personal care workers or whatever, it's fine to lump it all in one detail with all of the hours or whatever that looks like for all of them. The budget narrative also has a sort of just narrative section for you to provide information on all the other costs of the other costs in the budget, asking you to justify the grant expenses and the match. It's going to ask you, it really should include information as how you arrived at the budgeted numbers and an explanation as to why the costs are necessary, relevant for providing the service. So that is just an open narrative question that you can type out the information on that. In addition to the budget, we do ask you to submit the estimated number of units and unduplicated clients that would be served over the grant period. So the units of service is defined based on the various services. So I would encourage you to review the eligible services list to see what those definitions are. Could be an hour, could be a session, could be a trip, meal, etc. It really depends on the service you're asking for money for. So you're going to have to estimate the number of units of service that would be provided throughout the grant period. You're going to do that based on county. So it's going to ask you to break it out in the 8-county Denver region that we work in. In addition to that, you will have to submit estimated numbers of units of service for what we call non-compensated services. That is that information and assistance and outreach that we ask everybody to do. And then for nutrition programs, it's nutrition education and counseling that we consider a non-compensated service. We call it non-compensated because we don't tie the dollars to that service. However, like the cost for providing these INA and outreach for your program can be included in your budget. We just are going to tie the dollars to the other services that you're requesting funding for. Unduplicated client counts by targeted demographics are also going to be required, and that is broken out by county and targeted demographics. So the Older Americans Act requires that we target certain populations. So target older adults with the greatest economic and social need. That includes the demographics in the application that is demographics in the application include low-income individuals that identify as a member of minority racial or ethnic group, individuals that identify as a member of a minority racial or ethnic group, and individuals that live in a rural area. One thing to note here is that clients obviously can be a part of multiple of these demographic categories. So it's okay for them to be, for like it to be recorded for them to be recorded in each category. And so there's some duplication across that. There is a total unduplicated client count column on the system as well that's going to ask you for the total, regardless of these demographics, total unduplicated clients that you plan to serve in each of the counties by service. In addition, and then we also have the service narrative. So the narrative has a list of questions that needs to be completed for each service that's identified in the proposal. The questions are organized based on the evaluation criteria that we use to evaluate proposals. And it does include a question asking about the minimum amount of funding required for the service to be viable. This is a question DRCOG added last round, and really we use this information to determine if we're able to partially fund a service or not. And so we do encourage you to really consider that question. It's just asking you, it will ask you for a dollar amount of what sort of would be a minimum number for you to provide some level of service and what that level of service would look like. Again, we don't just like automatically go to that. It is a place we look at if we don't have funding to fully fund proposals, and we would look at whether we can partially fund things or not. The final three sections of the proposal is the overview. There's one question to provide general information about your organization and some survey. You heard about this opportunity. We also have a risk assessment that you'll have to fill out. The risk assessment is used if you're awarded funding to determine monitoring of the subaward. We don't provide the risk assessment information to the panel that scores the proposals. It's used internally by DRCOG. If you are successful and awarded funding, we do have a section for attachments. There are no required attachments that you have to upload, but you may include anything that's listed in the system, letters of support, or anything else you feel is relevant to include as an attachment. So getting into the evaluation criteria, so we have various criteria that we use to evaluate proposals. It includes the need for the service in the region, and that looks at whether the service has a compelling justification, the need for service has a compelling justification, the proposed service is in line with AAA goals and mission, including the AAA's 4-year plan on aging, whether you're able to serve multiple counties, serve specified underserved areas in the DRCOG region, your ability to reach the targeted populations of the Older Americans Act, and whether you coordinate with the community in carrying out your proposed program. We also look at experience, performance, and capability. So this is looking at how well your agency can meet the program objectives and compliance measures of Older Americans Act funding, and whether your application demonstrates an ability to provide services at the levels proposed, where you have an administrative structure to carry out the program, and if you're a returning provider or have received funding in the past, your past performance on contracts would also be a consideration here. Cost information, we look at the service costs and whether they're reasonable or justifiable, whether you have a financial audit or other fiscal controls, whether your agency is financially stable, and whether you're able to, your local matching funds, whether you're in your ability to leverage those either in kind or cash match. We also look at service outcomes, so how well your agency serves clients, whether your program demonstrates responsiveness to the client's needs and feedback, client satisfaction survey and service outcomes are measured, and whether you make changes to the programs based on that client feedback. And then if the program is offering an innovative approach to service delivery, that is also a factor here. And then we do look at the clarity, completeness, and responsiveness of the proposals. So how well was the proposal written? Was the all the questions answered? Was it filled out appropriately? Um, if you were interviewed, did you provide good responses to the questions in that interview? If you have letters of support uploaded, do they provide positive feedback as well? One thing to keep in mind here, all of the proposal narrative questions are character limited, so you might run out of space. So do your best to be concise, but give us as much information as necessary, and try not to be duplicative in your answers. So the next section here we'll get into is just contract requirements if you were awarded funding. So this is kind of the requirements of the grants if you were to be successful and get the funds. So just as far as the contracts go, all of these contracts from this funding opportunity are cost reimbursement contracts. That means that only the actual costs incurred to provide the service may be reimbursed. We do use a per unit rate reimbursement method for some services that really acts as a maximum reimbursement monthly to ensure that you provide the units of service in your contract. We do require that all cost reimbursement reporting be submitted to DRCOG by the 15th of the month following the month of service. So if it's at the end, so if you're submitting November, it's due, would be due December 15th, for example. DRCOG reimburses subrecipients after we get funding from the state. That can take up to 60 days or longer from the end of the month. So keep that in mind as well. So if you were submitting November, you might not receive payment for those November expenses until January, like the end of January timeframe. So you will have to have the ability to float the program for a fairly significant period of time before reimbursements can be made. All these services require service unit and client reporting in the state's database, SUDS. SUDS stands for State Unit Data System. So all of these grants all require that you assess clients for eligibility and request the information on the state's required assessment forms, and all of that information, as well as the units of service provided monthly by client, be submitted to the state system. And again, it's due on the 15th of the month following the month of service. You will be responsible for entering that data directly into the state system. So keep that in mind, that you will have to have that ability to and staff to be able to enter the data and report that information. Other reporting requirements, grants, we do have mandatory quarterly subrecipient meetings happens in July, October, January, and April. The state does require that yearly consumer satisfaction surveys be sent out to consumers served. We also require closeout reporting at the end of the year. DRCOG does on-site reviews and evaluations of providers yearly, and then the State Unit on Aging does review DRCOG services on a yearly basis as well. That does impact folks who receive funding because they go look at your services when evaluating DRCOG. One thing to keep in mind is that the Older Americans Act requires that clients be given the opportunity to voluntarily contribute to the cost of service. So you will have to have a policy in place for soliciting those contributions and processing them to ensure that they are used to expand the program for which they are received. The voluntary contributions are considered program income and must be tracked separately from regular donations that your organization receives and reported monthly to DRCOG. Those are used, they must go back to the program and expand the budget for the program and services that DRCOG is receiving. We do ask you to estimate this in the proposal. It is in the budget section. It's not taken into account in any way. So if you're unsure of what that might look like, you're more than welcome to just leave it as a zero. But we do ask you to estimate it in the proposal. So all the contracts do require some level of insurance. These are the minimum insurance. These are the insurance types here. The limits are available in the PDF of the funding opportunity that's posted in web grants. But we do require workers' compensation insurance, general liability insurance, auto liability insurance, security and privacy liability insurance, and then professional liability insurance as well. Generally speaking, most of those are either within the legal requirements or sort of at a minimum of like $1 million aggregate. But I would encourage you to look at the PDF that's in web grants to make sure that you can meet those insurance requirements because we will require you to submit a certificate of insurance if you were awarded the funds, but prior to the contract being executed. So all of our contracts do require business associates agreement as well. So DRCOG is a business associate of the Colorado Department of Human Services. And you will be given access to the state's database and will have access to information that is considered PHI. As such, all of our contracts do require you to submit or sign a business associates agreement with DRCOG since you will have that access into the system. Other contracts requirements to keep in mind is employment verification, compliance with equal employment opportunity regulations. Background checks are required under these grants for employees, volunteers working with clients. Colorado Adult Protective Services checks are also required for employees working with clients. And then you are required to have certain written policies and procedures, which includes client grievance procedure, process clients' complaints, waitlist procedures. You were to have to establish a wait list, client confidentiality policies, a targeting plan to target those targeted demographics of the Older Americans Act. If you're a nutrition and transportation subrecipient, the emergency response plan is a requirement as well. So some more requirements here. You will be required if you are awarded funding to submit a certificate of good standing with Secretary of State, if applicable. If your organization is required to be registered with them, that is something you can upload to the proposal if you'd like. You also must be registered with sam.gov and not debarred or suspended from receiving federal assistance. If you plan to subcontract out any of this funding to other contractors, all that has to be proved prior to you doing that by DRCOG. We do have some minimum spend down requirements within the contract to ensure that funding is spread throughout the year and not spent within the first few months of the year. And then a requirement that you're adhere to all federal state policies and procedures. That includes any relevant federal regulations, 2 CFR 200, the state's policy and procedure manual, state's rule manual, volume 10, as well as DRCOG contract. We will post this slide deck on web grants as well, so you'll be able to access the links here out to our Dropbox that has all those policies and procedures. And if required, you will be required to obtain all licenses, registrations, certifications as required by policy or law for these services. So that is all I have. You are welcome to, we'll have plenty of time here for questions, but if you have other questions after this, you're welcome to direct most questions to this email. It's really hard to see, but that is AAA_RFP@drcog.org. Having it underlined there kind of gets rid of the underscore. But you're more than welcome to reach out to that email. It goes to all of us on the team. And so we're able to ask that. If you have proposing a service and want to discuss eligibility with us, you can reach out to me or Aaron, our lead compliance specialist, and we're happy to chat with you about eligibility. And with that, I am happy to take questions if anybody has any. And you can feel free to put them in the chat or raise your hand. A question here, if we are applying for funding for multiple services, should they be lumped into one single application or separate applications? You can lump them into one single application if you'd like. Yeah, I mean, it's also okay if you want to do multiple applications as well, to kind of keep them separate. We do evaluate proposals based on the individual services. So regardless of whether it's lumped into one application, we're evaluating each individual service in that proposal. Do you have any other questions?
Hey Travis,
Hey,
long time no see.
all right.
Quick question, and you may have gone over this, but in the application, in the your website thing or
Mhm.
whatever, grant site, does it break down each funding part and then providers are able to then apply to each funding part, or does it just does DRCOG just automatically decide which funding part? So like if you if we were to do like, I don't know, transportation, but then also thought maybe through state funding for senior services funding line, how would that how does DRCOG determine that, or is that something we need to do as a provider or as the
Yeah.
applicant?
You don't need to identify that as the applicant, so it's just going to ask you to. I broke it out mostly for just informational purposes, but we determine the funding sources on the back end
Okay,
after funding is determined and what applications are being awarded.
okay, thank you.
Yep. So we got two questions or multiple questions in the chat. So, do the executive orders related to DEI impact this opportunity? You know, yeah, none, as far as I know, none of those have impacted like changes to targeted demographics or anything like that that we're being asked to target. I don't know if there's other things that you have in mind there. If you want to expand further on your question, I might be able to answer that a little bit better.
Yeah, hi Travis. This is Reed Trammell. I asked that question. I just mean like some federal grants, they're really not wanting folks to include language that could be considered, DEI, and I'm wondering if we should be careful in how we're writing these applications because of that, since the source of the funding is federal in a large part, or if DRCOG won't be taking that into consideration.
Yeah. The applications are really here and evaluated by DRCOG, and that is not something that we would be like looking at as something that would like make you ineligible or anything like that. This is really formula funding that comes from the feds down to the state. So there is a different just sort of way that this funding comes through. So while I can't say that nothing would change potentially, it's not something that we're looking at as a factor in evaluating proposals.
Thank you.
Yep. Next question in the chat, will you be sending the slides? Yes, the slides will actually get posted on the WebGrants portal. So there is, if you're out there, a section for attachments on the notice of funding on the funding opportunity that's in WebGrants. So we will post a PDF of those slides here by the end of the week. And we'll be able to, so you'll be able to access those, you'll be able to access the links and all of that as well. You mentioned cost reimbursement contracts. How do you handle variable costs, such as in the case of transportation where trips have different mileages? How was it done in the past? So the cost reimbursement contracts is really, since you're reporting, transportation is one of those ones that we don't use a unit rate reimbursement for because of the variable nature of that service. The costs you are reporting sort of to us after they happen. So by the 15th of the month following the month of service, you should have the costs for the prior month all sort of booked, and that would be then sort of the actual cost that you would report to us with supporting documentation of those costs, and then we would reimburse those those actual costs less the required match. So for transportation, for example, it's a 10% match. So if your actual costs for the month were $10,000, we would reimburse $9,000, and the other $1,000 would be the match requirements. Another question in the chat is, will you consider a new program for homemaker and personal care that just launched and only serving a handful of people with plans to grow? Yes, we will consider all proposals that get submitted to us. That is new programs, whatever that looks like. You know, you can submit the application and we'll evaluate it. We'll go from there. So if you want to chat more about it, just to make sure you're on the same page and you meet the eligibility requirements, we can chat about that offline. So all right. Are there any other questions for me? Well, I'm not seeing any other questions. I'll stick around for a little bit in case some other ones pop up, but thank you all for joining us today, and feel free to reach out to us if you have any other questions that pop up, or if you're working through the applications and you run into any issues, feel free to reach out. We can help troubleshoot the system. But yeah, thank you for your interest in the opportunity, and thank you for joining us today. I appreciate it. We'll, yeah, I'll stick around for a little bit just in case something pops up, but feel free to hop off. Thanks.
Travis, I just had a question for you regarding the that personnel page, which I think might be new, where you break out the personnel expenses.
Yep.
I think it said on there something like you only have to fill this out if indirect expense is going to toward the payment of salary. Is that correct?
The personnel that shouldn't, yeah, I can double check, but the personnel would be filled out regardless if you have personnel being charged. I think the indirect, because there's two new tables. One is the personnel details that has that listing of personnel that if you are using any personnel being charged to the grant, you'll need to fill that out. Then there's the indirect cost calculation. So, and really you only need to fill out the indirect cost calculation if you are charging indirect costs to the grant. But those are two separate sections. I can make sure the instructions didn't get
Oh, okay. Thanks.
jumbled up there. Yeah.
Okay.
There's a question from Jennifer. Would you use the personnel section to account for in-kind staff salary match? Yes. So if you're and volunteer time as well, that should be like typically if you're using in-kind staff time or volunteer time, like you would have it identified as an in-kind revenue. The expense would be listed in the personnel section of the budget. And then, yes, you should have a line on that to really, it's calculating what your volunteer hours would look like or the in-kind staff and how that in-kind is being calculated. So yes, you should include that in the personnel section. All right. Well, thank y'all for joining us again. Appreciate it. Hope y'all have a great rest of your day.